Write in the comments if you've ever taken ibuprofen for anything. Honestly, that's probably most of us, right? What are you taking it for? You're taking it to lower a fever, to reduce pain, to lower inflammation, whether that's from back pain, joint pain, arthritis, menstrual cramps, fevers. I mean, it's used for so many things, and it's so common. I use it. In fact, I keep some in my purse in case I need it while I'm out. These medications are awesome, but they can have side effects. I'm talking about some of the most serious side effects I see, certainly as a family doctor. Now, the first thing you should know is that ibuprofen is the generic name for what you see over the counter as Motrin or Advil, okay? But it's not the only medicine in this class or category. Ibuprofen is a common name, but there's also naproxen, which is also Aleve. You probably heard of that. And there are actually plenty of other over-the-counter and prescription medications in this class. See, they belong to, ibuprofen in particular, and the rest of them that I'm talking about, belong to a class of medications called non-selective, non-steroidal anti-inflammatory drugs. The way they work is they inhibit an enzyme called cyclooxygenase, or COX. Now, all you need to know is that this is how they work, and it's a big deal because this sort of inhibiting of this enzyme sets off a cascade of events that is what allows our pain and our fever and our inflammation to go down. So it's super important. But I know you're wondering, all right, so Dr. Jen, let's get to the dangerous side effects. All right, let's talk about them, all right? By the way, I'm Dr. Jen. I'm a family doctor. Good to see you. First of all is kidney function. Yeah, this is something I'm always talking to my patients about when it comes to popping ibuprofen, Motrin, Advil, or whatever non-steroidal anti-inflammatory drugs. They can damage your kidneys. That's right. Now, it's not sort of set in stone that this is going to happen, but depending on the dose you take, how long you take it, how often you take it, your underlying conditions that you already have, all of those things go into determining how likely you are to have your kidneys damaged by these types of medications. But know that it's not okay just to be popping the ibuprofen without checking in with your doctor and making sure that that's okay. And generally, I mean, honestly, I can't think of really many patients of mine that I feel it's okay for them to take these medications all the time. I'm not your doctor. You got to talk to your doctor, but this is why I'm telling you, okay? You got to know this. All right. The other thing is, kind of similar to kidney damage, and by the way, yes, it can cause some kidney damage. There can also be electrolyte abnormalities, changes in your potassium, your sodium, things like that. Now, I don't see that a lot in extreme levels due to NSAIDs, but it is quite possible, okay? Now, something else I see a lot as a family doctor is these medications like ibuprofen and stuff, if you take them long enough, high enough doses, etc., they can actually increase your blood pressure. That's right. And I've done plenty of videos on blood pressure. In fact, I'm going to link some here about things you can do to lower your blood pressure. NSAIDs, things like ibuprofen, Motrin, Advil, Aleve, they can increase your blood pressure. So again, another reason why you don't just want to be popping these medications in isolation without your doctor knowing. Number one, so they can guide you if this is even okay to do, which often for many patients it's not. But number two, take that into consideration when it comes to your blood pressure and other things. That's a big one. Another big one is it can cause or sort of increase your risk for heart problems, major heart problems, congestive heart failure, heart disease, and so many other things. This is a big deal, especially if you've had heart problems, heart attacks, etc. If you are taking Motrin, you need to be talking to your family doctor, your internal medicine doctor, your cardiologist about if it's okay to take these medications, all right? Now, another big one, guys, the stomach. These medications can really sort of do a number on the stomach and the intestines, cause peptic ulcer disease, that's stomach ulcers, contribute to bleeding, bleeding ulcers, dyspepsia. And honestly, I can't tell you how many times over the years where somebody ends up having stomach problems, and one of the questions is, hey, do you take Motrin, Advil, whatever? And they're like, oh, yeah. And we find that it's contributing to their underlying condition. Yeah, it's a big deal. Okay, beware. Some other things, it may increase liver function tests, may cause liver damage. That's not as common. That's not something I see as common. It's not as common. There are other things that can happen as well. That is not the whole list. But let me just tell you that the kidney damage issue, the stomach issues, the worsening of the blood pressure, those are some of the biggest consequences that I see of people taking non-steroidal anti-inflammatory drugs like ibuprofen, etc. Again, I am not saying these medications are bad. In fact, they are quite amazing. The question is how often, how much, your underlying condition, etc. If you're supposed to be taking them, if you should be doing something else. That's the question. It's all about, is the medication and the dose you're taking right for you? Guys, please write in the comments your thoughts. Share this video with other people so that they know. Please subscribe to my channel on YouTube. Please follow my page on Facebook. I'm Dr. Jen. It's good to see you. I'm on TikTok, LinkedIn, WhatsApp, Instagram, you name it. Follow me there and go to my website, drjencaudle.com, to sign up for my free health newsletter. Love y'all. Bye.